It may have appeared at first that the federal spending cuts, known as the sequester, might not cut too deeply. But as some Medicare patients who need chemotherapy are learning to their dismay, there's some real pain in the process.
For many of our patients, it's going to put us with a very hard choice. We either continue to treat them in our office at a financial loss and ultimately predictably go out of business in the future, or we shift their care into the hospital, which is more expensive for the patient, less convenient for the patient, and much harder for me to oversee their care in a quality way.
We physicians are getting worried that this is the thing that will tip the balance, that number one would push us to send the patient to the hospital for the chemo with all those consequences, including the cost.
If you know business 101, nobody is going to stay in the business if they lose money. And what it means to the patient is they probably have to travel more to get the same care in the hospital.
And I said, well, you would have to set it up at the hospital and wait for a radiologist. And she says, Shelley, I am too sick to go to the hospital.
I think Washington and the lawmakers in Washington need to understand that this is not just about a 2% cut. It's very easy to frame this as 2% of a very large thing. This is real lives, real patients.
It's scary to, I know how they treat me here, and I know how to get treated in the hospital.
He's one of thousands of senior citizens with cancer being told by clinics to get their chemo elsewhere. In this practice alone, 5,000 patients have been told they can no longer be treated here. Patients blame lawmakers.